I've been doing free market medicine since I first opened. I've never taken any insurance money except for Medicare, because when I very first started, you were automatically opted in and you had to opt out, which I did, I think, about 10 years ago. So I've had my practice for 14 years and I've never taken any insurance money. So it can be done. One of the main things being a fee-for-service doctor or a doctor that's out of the insurance industry is that you actually get to take care of patients and do what they want and treat them the way they want to be treated. Patients hate being treated like a 7-digit code. Nowadays, nobody gets a second opinion. They get stuck with what they get. Patients want to get a different opinion sometimes. They don't like getting an answering machine telling them just to call 911. I can't tell you how many calls I get from friends of friends because when they call their doctor's office, they get nothing. Or they get a recording that says call 911. That's not medical care. 911 is not going to help you if you don't know how much Tylenol to give your baby. They don't like that an insurance clerk will refuse them treatment that we've ordered, that we have to get it authorized even though we've already written the prescription. And they're afraid of dying while waiting in line for treatment. As we've seen at the VA recently, people are waiting a long time to get to see the doctor. And that's not right. When you're sick, you're sick. When you're hurt, you're hurt. Okay, so the average waiting time in the United States to see a doctor is 18 days. That's for, really it comes out, it averages out for a specialist or for primary care. You guys actually in Dallas do extremely well. It's actually, yours is the lowest in the nation at only 5 days to wait to see primary care. However, where I'm in Marble Falls, Texas, which is about 3 hours from here, and the wait is about 2 weeks. So one of the things I offer is same-day appointments. So if you've never seen me before and you're really sick, I'll still see you. So huge benefit. Again, you can't wait 18 days when you're sick. Okay, what doctors hate, which you guys already know. Hate doing paperwork. Most doctors spend about 50% of their time doing paperwork. I spend about 5%, maybe 2% of my time doing paperwork, and most of it I do all at the exact same time. When I see my last patient, I'm done for the day. Whatever's in the cash drawer, I take home. My practice is extremely simple. It's money in, money out. That's it. The main thing for me that I hate, and the reason I am not encouraging my children to go into medicine, is because of the uncertainty in healthcare. People who are in the insurance industry, the amount we get paid goes down, 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 down. The amount of responsibilities goes up, 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 up. Paperwork goes up. It starts to become where it's not worth it, even though being a doctor is one of the best jobs in the entire world. It starts to get where you don't want to be silly about it either. So just the fact that I don't know where healthcare is going to be in the next 10 years or 20 years or 40 years makes me very apprehensive about telling my daughter who wants to go into the healthcare field about being a doctor. They don't like battling insurance companies, and this is one thing I am so grateful for every day. Every once in a while, I do still have to battle an insurance company for somebody with the worst headache of their life and they need an MRI, and I have to get on the phone and wait on the phone for 30 minutes while I wonder if this person has an aneurysm or not and is dying in front of my eyes. I can't imagine how you guys do it when you have to do that with almost everything. And the hassle factor. There's so much in medicine now that's just made to make your life difficult. All the nonsense, computer forms, the prior authorizations, explaining the need for every single test you want, and having to talk to undereducated insurance people on the phone and explain to them why you want something when they really don't know anything about medicine to begin with. The amount of codes, this is the Obamacare law, which I'm sure we've all read front to back. Like, nobody can read this, nobody can do this, but legally you have to. And then the ridiculousness of the codes. For example, in the ICD-10 codes, there's a code for struck by turtle, initial encounter. There's one for a subsequent encounter of being struck by a turtle and struck by turtle sequelae. There's one code for bit by parrot. There's one code for bit by macaw. These are different codes. If you pick the wrong code, you're actually committing fraud. I don't want to commit fraud, and I don't know what birds are birds. So Oh yeah, there's also one for drowning and submersion due to falling or jumping from water skis, burn due to water skis on fire. And like, I went through the whole internet to see if there was actually any cases of people being burned while on water skis, and I could not find it. And the internet is big. So I'm pretty sure a lot of these codes are just totally and completely made up. And for me, the main reason I decided not to take insurance was because I didn't feel like I had enough time to spend with patients. If I wanted to spend 5 minutes with one patient and an hour and a half with another patient, I wanted to be able to. Where I worked in my residency, we had a 7-minute time frame. We had to flip patients through in 7 minutes. And I knew if I took insurance that I would be expected to go pretty darn quickly. And as an internist, that's the last thing I really wanted to do. I just read this interesting article in the New York Times, and it was a study done at Johns Hopkins and the University of Maryland. They did it at their respective hospitals, and it was with the interns and their 900 hours of their training, and 12% of their time was spent with the patients. That's it. Can you imagine your whole internship, you only spent 12% of your time? So that's these interns right now, the ones who are becoming physicians right now, are only spending an average of 8 minutes per patient during their training. That's when you're at your slowest. So they spend much more of their time in front of a computer screen than with our patients. And half of their time is spent documenting, which again has to be away from the patients because they're in front of a computer screen. I don't think this is the right direction to go. As far as opting out of all insurance, I'm going to use it that way even though it's Medicare too, but getting out of all insurance, if you ask me, are there opportunities? There are tons of opportunities, especially in Texas. Texas has the highest uninsured rate, and you don't have to take care of uninsured people. A lot of my patients do have insurance of some kind. However, there's also a big population of people who don't have insurance. And they're all ages. They go across the whole spectrum. I like the young people, the 19 to 34-year-olds. Those are the easy ones. 34% of them in Texas don't have insurance. Gaps, regions, Texas, we don't got none. And then the eligibility. Some of these people are eligible, some are not. I actually see quite a few people who aren't even eligible due to immigration status. I like to take care of the Mexican Americans and the Hispanics. You don't have to. Again, everybody will find their niche, but some of my patients don't even have the opportunity. When I look at, these are the 8 reasons Texans don't have insurance, but personally, I have number one. Most of my patients are the quote-unquote willfully uninsured, the ones that don't have insurance. So they're the self-employed. I have tons of real estate agents, preachers, beauticians, builders, and just rebels, people who just don't want to be a part of the system. I have a lot of patients that come to see me because all their information stays in my office. And I have some patients who come to see me for certain problems that they just want to stay in my office. They actually want this thing called patient confidentiality, which is really different than HIPAA. So some people aren't enrolled because it is a confusing and difficult process. Some work for small employers that don't offer it. Part-time, seasonal, and contract laborers don't have the same option with their companies. Again, recent immigrants. I see quite a few people have actually been denied coverage, and then unemployed or very low income. I probably don't see that last tier, but the guy who works in the same office with me who also doesn't take any insurance, he does a lot of very low income people, and he still somehow makes it work. So it just depends on how you want to do it. He gets a lot of dinners, he gets a lot of chickens, he gets a lot of landscape, but he still does it, and he loves it. He loves it. So we kind of, and most people think it's too expensive. I think it's too expensive. I think if you go to see the doctor and you pay for it, it's way cheaper than paying every month. I'm not saying there shouldn't be some sort of safety net, but people who actually do the math, especially young people, they're not going to sign up for Obamacare. So how much does it actually cost to see the doctor? Well, the lowest level of Obamacare has an over $6,000 deductible. The silver plan's $3,000. With co-insurance, patients still on average pay 26% of the charge to see their primary care physician. Copays are from $60 down to $20, and the average copay for urgent care is $75 with a range of $120 to $40. Guess how much I charge for an urgent care visit? $75. So you can come see me and pay cash for the same price you would with one of the middle plans. It comes out totally equal, which is kind of what you were talking about with yours. On the other side of the coin, the average women's haircut is $48 in the United States. I'm worth more than 2 haircuts. And they go every 8 to 12 weeks to get a haircut. They don't have to come see me that much. Okay, I didn't invent this. I actually feel like I just totally missed that area when a lot of you guys got into insurance. So I couldn't find a picture of my old doctor, but the guy who took care of us growing up is exactly what I do. It's not magic. I just gave a talk at the Benjamin Rush Institute, and they were like, "Where'd you come up with this fantastic idea?" I'm like, it's the same old thing. So what I do, which we talked a little about, I give a discount to teachers and preachers. A, because I really like those people, and B, those people are my biggest referrals. Those two groups of people talk more than anybody else and know every single person in the community. If you are one of my patients who's already established, I see you for free. I actually see referrals for free too. If it's a friend of a friend or it's a referral from another doctor, and they have cancer, I see them for free. Love it. It's extremely rewarding to me. It makes my job really fun. I also do a thing called BOGOs, which is buy one, get one. I like this. I couldn't do this back when I was in residency, but if I see somebody and I'm worried about them, I charge them a tiny bit more. Then they get to come back for a free visit. If they don't come, I get the free money. If they do come, I sleep better at night. I do house calls. Usually the house calls are on the people who are dying or some extenuating circumstance. I don't do them all the time, but when I do, I find them really rewarding. Like a few weeks ago, I had a mom with a 3-year-old and a 1-year-old who had a really bad migraine and couldn't stop vomiting. 15 minutes, go over there, shot of Imitrex, little Zofran on the tongue, done. Hero. I let my patients call me at home. I've only had one person all 14 years ever abuse that. They call me when they need me. Every single phone call starts out with, "Dr. Madrigal, I'm so sorry, but..." I love that. We have a mutual respect that goes back and forth. It works extremely well. I don't gouge the patients. I charge them fairly. I give them a good deal. They give me a good deal. It works out really nicely. And every one of my patients I treat like a VIP. And that's without an annual fee, which is another way to do it. I don't do it that way. It works because people get to choose where their healthcare dollars go. I have a billionaire in my practice and I see migrant workers. Everybody gets treated the same. Everybody who comes in my practice gets great healthcare. There's no outside organization that stands to make a profit or lose money if I do something different. I do exactly what I want with every single patient. And my incentive is to take good care of the patient. My whole business started just by word of mouth, and I figure if I make a bad mistake, the opposite could happen too. So my incentive every single time, every single patient, is to do the best job I possibly can. I used to only have 1 staff, now I have 3. So I don't feel like I have that big a staff. I have 5,000 patients, so I feel like I need a little bigger staff now, but less staff. I don't have any wasted time on the phone, talking to different agencies. I have no accounts receivable. Like I said, whatever's in the drawer at the end of the day pretty much is what goes home with me. There's a lot less paperwork, and my time is spent just on patients and patient care. I have more time to research. I have time to read every day. Love it. So if you want to know about the money side, I'll talk to you later about it. Basically, just figure out how much you want to make. Most doctors' offices have to double it for their overhead. Divide out how many weeks you want to work. Divide out how many patients you want to see a day. I only work 4 days a week. I have to have a day off because I like to get in there and work really, really hard on those 4 days. Work from can till can't, but I need a day off in the middle. Again, very traditional, Wednesday off, doctor golf day. Love it. I know for me, I have to charge an average of $125 per patient, which usually, like a sick visit for me is $75. With lab, whatever else happens, it ends up being an average of $125. I actually make more than that now, but. Plan for efficiency. My office is extremely efficient. Obviously, I do not have an interior decorator. I don't think my patients care. I have a low-cost EMR. I use one called Amazing Charts that I think is $5,000 now. When I started, it was $2,000. I started low, went slow. I had one exam table, then two. I had, some tongue depressors that fell into my bag at the ER. Slowly, I was able to replace them and buy new. But I started really, really low and went slow and got there pretty quick. Pay yourself first. Don't go into debt to be a doctor when you're actually taking care of people. Again, charge what's fair for you and for your patients. Oh, if you don't like something, the cool thing about this is you can charge more. I hate abscesses. I just hate them. I charge like $300 for them. I kind of like them now. Plus, you can also charge patients, difficult patients, more, which is also kind of makes you like them more. And don't be afraid to promote yourself. Oh, and offer services others don't. One of the other things we do, we do the same day appointments. We also offer low-cost labs, which I actually still make money on. I can get a CBC for $3.50. I charge $15 for it. The local lab in town charges $79 for it. So everybody wins. Opt out. You have to do it right. Absolutely go to the AAPS webpage. Make sure you do it exactly right. You're talking about the federal government. Don't mess up on this one. Every single one of my patients has signed a contract that they want me to take care of them and that I don't take Medicare and they can't get reimbursed. But make sure you follow that to the T. And then what we love, what I get to do, spending time with patients. This guy was in the second wave on the beach of Normandy. He was my oldest patient, actually. He just passed. Taking care of generations. I got 3 right there. Taking care of the difficult patients, really not so bad. I didn't charge him more. Even the non-compliant patients. But I have a practice where this guy's a widower. I have a cool practice where at Christmas time, he comes, dresses up like this, and just stays in the office all day. I love it. I love it. Empowering the patients. This is one of my paraplegic patients who sent me this text. I came back from lunch. He left the $41 it costs to run a UA CNS because he knows how much it costs, and he left it and sent me a text, and we're good. I love that it's like that. They feel like it's really their part of their home. Loving on the patients. I have time and energy to actually love on them. And I let them love back on me. This one guy does stained glass in my house. This other lady is 79 years old, and she took a trapeze lesson with me. She's actually floating down the Amazon as we speak. I had to give her a lot of shots. I have an extremely happy work environment. I have 2 babies named after me. One has a family with 10 kids, so they might have run out of names. And that one, both of them are named Juliette, but the one that's in the family with 10, she came in wearing a tutu, and her mom said, "Jules," and both of us went, "Yeah?" I said, "Oh my gosh, please tell me you're not calling her Jules." And she's like, "We had to." And this is Julieta. We like being able to help wherever we're needed. This was in Peru, but this happens to me at almost every single AAPS meeting, something like this. But I like being able to still do this, and I feel like my friends who are overworked in the offices don't notice accidents and emergencies and don't have the mental energy to participate. I love being that person. We have time and energy to do charity work all over the world. We don't even mind dragging our kids to the hospital with us if we're actually taking care of people and we love on them. And we get to see the beauty of life every single day. That's the baby they were waiting for. And this is how I broke my hand. Thank you very much for letting me be here today.